We're going to be doing a treatment for lower trapezius and a little bit of middle trapezius. So just orienting yourself with the muscle known as trapezius. It is a major scapular mover. So the lower trapezius has an attachment along the lower thoracic spine in around spinous process of thoracic 6, 7, 8, 9, 10, 11, and 12. So we have an origin all along these spinous processes in here, and then the muscle fiber is going to run up in this direction, heading towards the spine of the scapula, and specifically the tubercle on the spine of the scapula, which is right in this kind of indentation. You can kind of see right in here. So with a very light kind of pressure, since it's the first layer of muscle, I'm going to just place my fingers all along that outer edge and kind of push in, giving you an idea of what the shape of this muscle is going to look like, something like that. I'm actually going to bring my partner's arm forward here, have her just rest it. So same idea, you can just start to see this line showing up. I'm going to place my fingers along it, and then I'm going to ask her to lift her arm up out in front of her. And right away, I can start to palpate that edge of lower trap right along here. So now that I want you to see this edge line, I want to show you how I can do a few techniques to try to increase the length of this or reduce tone, or possibly kind of palpate it. You can see me cross fibering it right now, and it has a very unique fiber direction of this muscle, which it can be confusing with the erectors or even the rhomboids. So for now, let's bring the arm back to the side. I'm going to do just a little bit of compression into this area and a little bit of techniques without oil. It's more just like a dry stroke, or into what some people might refer more like a fascial technique. And my objective with this is I'm trying to bring that scapula up into more elevation, which is the opposite of its function in depression and retraction. So I want to try to increase the length of some of these tissues. Good. Again, I want to palpate that edge. So I might take 2 thumbs here. I'm just going to try to push right into that first layer and pick up. So I might try mobilizing the lateral border of the muscle, since it's a little bit more slackened right now. Now this might look like I'm just grabbing skin, but I'll show you in a second the difference. So if this is her skin that I'm picking up, but if I go underneath it, you'll be able to see right here, watching the camera really closely here, this is me grabbing muscle versus me just grabbing the skin. So I want to go into that slightly deeper layer. I'm going to try bowing that muscle fiber centrally, like so. Good. If I had lots of oil or lotion on my skin, I would just be sliding along the surface of the skin. So I want to do this where I have a little bit more grip with my fingers. Good. And again, I'm going to go closer to that insertion up here on the scapula. Okay. So again, do a quick little reassessment, repalpate that. I'm going to fire that off again so you'll see that twitch. There we go. Nice clear defined twitch line of her lower traps. So I'm going to try and do a couple massage techniques and see if we can get this tone to go down a little bit. One more time, I promise not to annoy you too much with that. So our line running something like that. I'm going to take her arm, I'm just going to hang it and put it again just forward for her. Just adjust this pillow a little bit if you want to just rest your arm like that. Let's adjust this pillow. I'm just going to take that out for the moment, if you don't mind. Okay. Standing up from the head. And then just kind of in all directions here, making sure we've Warmed up some of the tissue. Yes, I am going across the spine, but I don't have any pressure going down, so I'm really starting my pressure once I get into that side of the body. Good. And the more you see me working in this area, you are definitely starting to see a little bit more redness as we're increasing a little bit of circulation to that space. Okay, and now I'm going to try manipulating the scapula. So since this muscle's action is to depress and retract the scapula, what I'm going to try to do is bring it closer towards the ground on the table here. So there is our border of the scapula right along here. So I'm going to take my thumb and I'm going to reinforce with my fingertip, and I'm just going to load into that medial border. Now, it does look like I'm putting a lot of pressure into my thumb, but again, I'm trying to put my pressure through my fingertips into the thumb, just like it's a tool here. You're doing okay with the pressure where I am right now? Yeah. Awesome. So we'll do a little bit of a pressure and release. Again, I want to stick on that fiber direction. I don't want to go all the way down along the inferior. I want to stay close to that root and tubercle of the spine. So I'm going to do the same technique right above. Your tissues are fighting me a little bit, but that's okay. So I'm just going to sustain my pressure as long as this is comfortable on a pain scale. I'm just going to hold it and wait for that tissue to try and let go and release a little bit. Good. So I'm going to release my pressure. Again, that was okay, my pressure in that space? Yeah. Work myself back. Now this one's going to be fun. We're going to take the arm and bring it back to her side. But this time I'm going to cup the shoulder and I want to lift it up a little bit. So I'm just going to try to do a little bit of passive retraction here. So I'm placing my fingers towards that coracoid process in the anterior glenohumeral joint. I'm going to lift up her scapula using my other hand. So I'm pulling it into retraction, and then I'm going to scoop the scapula, and I'm going to try and hold pressure between both my hands. You can see there's a little bit of twitching happening just in front of my fingertips there. Let's try that again. So again, spine of the scapula is here, the root's about there, so I'm going to scoop up, following along those trapezius points, and just hold pressure. Nice little twitch again in response to my pressure there. One more time, nice and slow, following it up, trapezius towards that root. Good. All right. We'll clear through that area. I'm going to replace her shoulder pillow back. So that shoulder pillow, it's naturally starting to bring that scapula into some retraction, so that's really nice. So we often use these pillows, especially if you're trying to retract a scapula. So if the protractors like serratus anterior, pectoralis muscles are too tight, we often use some sort of a retractor to help us bring the scapula back a little bit. Okay, I'm gonna go back and repalpate our muscle. Still a little bit twingy in that space, but it's definitely loosened up a little bit, which is nice to see. I'm going to run my ulnar border through the area a little bit here. So this will be a little bit higher on a pain scale. Let me know if this again gets a little bit too much for you. So I'm just going to start by doing a test run for my scapula, making sure I don't drive the bony part over top of the root. So I'm just using ulnar side of my hand, going right up, and then when I get close to the superior angle of the scapula, I'm going to go over top of trapezius. I'll repeat that a few times here. And each time I'm just adding just a little bit more pressure. How are we doing with the pain scale?
Good, just go to 2 or 3.
2 or 3, perfect. Okay. Slow it down just a little bit here. So what I'd like you to do is to bring your shoulder up and back for me just a little bit so I can feel that pressure right here. Okay, and relax. Good. And again, if you were to do that one more time just for the camera's sake, so right here is the muscle I'm trying to follow along, and relax back down. Now there isn't any pressure on my thumb. Some people like to tuck it. Mine's just kind of like resting as a guiding tool. I don't want my tendon sticking up the whole time, so it's just basically resting as I put pressure through my proximal phalanges, basically of the knuckle. Good, nice and slow. And repeat that one more time. So again, just start to raise your shoulder up a little bit. Perfect, just like that. Now relax. Taking my time, just allowing the body to kind of respond to my pressures. I'm going right over top of the erectors in this area, as well as rhomboids and trapezius. Good. And I'm going to go back to bringing her arm out in front of her. It's resting here. And I'm going to go to the opposite side of the table one more time. And this time I'm going to be following all the way from the lower thoracic towards that insertion point. So if you can just start to raise your arm slightly up. Good, that's enough right there. Let's do that one more time. She just starts to raise it up in front of her. That's enough for me to follow the fibers. So this is basically the equivalent of me going to be doing some muscle belly stripping of the lower trapezius, starting at the lower origin points and working my way up towards that insertion point. And there's the scapula, my pressure. How was that on our scale of 1 to 5?
It's good as like 3, 4.
Okay, can you just start to raise your arm up one more time? Perfect, and relax. Good, let's do at least one more pass here. So my inside hand is the one that I have my pressure, my outside hand is the one I'm leaning on. So I'm getting extra weight on my fingertips themselves. And yet, because I am going over top of ribs, if I was to use my knuckles, I might end up feeling rib with each trying to pass. So at least there's a little bit of give from underneath my finger pads. I also want to take caution not to jab my nail into the scapula and the skin in that area. So make sure your nails are trimmed. Okay. All right, we're basically gonna clear out some of this area, but I wanna make sure, because lower trapezius is often weak in a lot of individuals, so even though it has trigger points or has some tension in it, overall this muscle is often weak and stretched out. So we definitely don't want to just walk away from treatment. We want our individual to reactivate and make sure it's not too painful when they do so. So essentially what they're going to do is almost like a Superman. They're going to raise that arm up in front of them. And I like to have people hold their thumb up towards the air. So she's doing a contraction of that. Is there any pain with that as you're holding your arm up? Okay, can you do that 4 more times for me? And I'm just palpating to see how the muscle's responding with each one of those movements. It's nice and slow. I'm looking for twitches, or again, if there's a lot of discomfort inside that. Looks good. And we can just bring your arm back to your side. And we'll just finish with a few more strokes along it. And we'll just do another quick little palpate and see how that's feeling. And that feels quite a bit softer in that area, which is nice. That's going to conclude our treatment of the lower trapezius today.